Let us go to disease and syndrome. The topic is modern Chinese medical practice. Generally speaking, both disease and pattern of disharmony are ways of defining nosological entities, that is, functional and organic disorders that occur in the body. However, disease in this context is a broader category of manifestation, whereas a pattern refers specifically to the underlying pathological mechanisms that bring the disease into being. A disease process can be divided into stages or parts, each of which would correspond to a pattern. Therefore, more than one pattern could underlie a given patient's presentation, or the pattern could change as the disease evolves. In modern Chinese medical practice, practitioners use the concept of disease to refer to conditions with clearly defined etiology, occurrence, pathomechanism, course, and prognosis. That is common cold, for example, common cold, dysentery, lung abscess, asthma, hypertension, etc. However, for TCM treatment to be effective, it must address the underlying process, that is the pattern of disharmony. At different stages in its development, any given disease may be the result of different patterns. Conversely, any given pattern may manifest itself in more than one disease. In this context, the disease entity represents the complete pathological process, whereas the pattern explains what is going on at any given stage. As mentioned earlier, TCM practice demands that the pattern of disharmony underlying a disease presentation be determined prior to arriving at a therapeutic principle and corresponding treatment. In the case of common cold, for example, a TCM practitioner must determine if the underlying pattern is invasion by wind heat, wind cold, or a number of other possible patterns. This conclusion will determine which treatment will be used. The disease name refers to a clearly defined pathological entity, and the pattern explains the underlying disease mechanism of the disease. Historically, TCM has identified a number of nosological entities whose etiology, occurrence, pathomechanism, and course are well defined and understood. These are also referred to as diseases, although they do not exactly correspond to diseases as they are known in biomedicine. Examples of these are atrophy disorder, wind stroke, painful obstruction, malarial disorder, wasting and thirsting disorder, and so on. These TCM diseases are also diagnosed and treated according to other underlying pattern of disharmony, which changes as the condition evolves. Conversely, TCM regards some isolated symptoms as separate pathological conditions, which are also referred to as diseases. Examples of these include headache, abdominal pain, insomnia, dizziness, painful urination, and chest pain. As always, within TCM, pattern discrimination determines the treatment. Thank you so much